Hey everyone, what's up? This is Dr. Charlie Johnson, physical therapist, and if you've been told that you have a bad back because you have facet joint problems, disc problems, SI joint problems, arthritis, spondylolisthesis, spondylosis, bone spurs, all the different big, scary, ugly terms, and you want to heal naturally, then chances are you can. But you may be led to believe that those problems are the cause of your pain, which will lead you down a path of unnecessary pills, shots, or surgeries. And in case you can't tell, I'm sort of ticked because I just got off the phone with an individual who has spinal stenosis, but his symptoms do not match it at all. And instead, he's being put in a box. He's been treated as a picture, not as a person. And he will go down the path of getting unnecessary pill shots or surgery because he believes that his neurosurgeon is smarter than he is. Little do you know, many people have bad backs and don't need to change anything about their bad back to heal naturally. And so these are the questions that I would recommend you ask your surgeon or whoever you're chatting with who's suggesting you have a bad back and that the image needs to be fixed in order for you to experience pain relief. And so I'm going to role play a typical or classic conversation between someone like yourself with back or sciatica problems, a 60-year-old lady, my wife is going to act as her, and I am going to be the physician or the specialist in this area, the surgeon who is suggesting that you have these problems and that's why you hurt. Miss, you have a really bad back. I mean, look at this picture here.
Mr. Surgeon, what do you mean?
Dr. Surgeon.
Dr. Surgeon, what do you mean?
Well, look at all this. You have disc desiccation, degenerative disc disease, degenerative joint disease, facet joint problems. You have SI joint issues. It's decrepit, it's decroding. You've got degenerative joint disease in your hip osteoarthritis. Does that run in your family?
Yeah.
And look at these hip bones, they're all out of whack. How old are you again?
60.
This looks like the back of an 80-year-old. Yeah, I'm sorry.
That sounds scary and terrible, and I have no idea what you just said.
Do you have any more questions for me?
Yeah, so are there like people who have some of these issues but don't feel any pain?
Yes, lots and lots of them.
Okay, so are you saying that what you found here on my MRI is considered normal for someone of my age, 60?
Yes, absolutely.
So how can you tell the difference between findings that are normal and don't cause any pain versus those that do cause pain?
We can't.
You can't. So could you bring me through like some movements or something like that?
Your problem's here on the image.
But you don't know that that's the cause of my pain?
Ain't nobody got time for that movement exam, okay?
So what percent of people my age, 60, have these findings but feel no symptoms at all?
I'm so upset that you asked that question because nobody knows about this. Many large-scale studies show that people your age have these problems and feel nothing. For example, disc degeneration, 88% of 60-year-olds have degeneration of their disc and feel no pain at all. 69% of people 60 years old have disc bulges and feel no pain at all. They don't know, no pain. They don't even know it until we show them this picture and start circling things in red. 25% of people your age will have annular fissures, tears in the outer wall of their disc, and feel no pain. Facet degeneration, remember that DJD, degenerative joint disease? 50% of people, half of your friends your age, will have that and feel no pain at all. And then some people, I didn't even get to the sideways image, the image from the side. This is just the front image, the front to back. Will have slippage of their vertebrae. We call this spondylolisthesis. Not a good thing, but 23% of people your age will have it and feel no pain.
Well, would it be abnormal for me then to have like a clean MRI with no findings at all?
I would expect you to have an MRI that looks sort of like this.
So this is normal?
Yes, this is normal for someone your age.
So let me ask you this. If you were to take two images of my bad back, one in the morning, one in the night, same day, would they look any different?
No, I would not expect them to look drastically different.
Okay, so assuming my back is bad all hours of the day, then why do I hurt sometimes during the day and not other times? Like my pain goes up and down throughout the day.
Yes, your image stays the same, but your pain goes up and down? Is that what you're asking?
Yes.
That makes no sense. I could not answer that. It's a very good question. It seems as though your image is not connected to your symptoms.
So if my pain can change, but my image doesn't change, then why are we focused on fixing all the findings that you have here on my image?
Because that's why you're here, and that's what I get paid to do.
Well, Dr. Surgeon,
Thank you.
how can you best help me and not my image?
Well, we could do some pills. We could try some injections. We could try injecting the L4, L5 facet, because remember, you've got some degeneration there. I know all your friends do too, but for you, maybe it'll work. Or we could do surgery, and we could start here, maybe a fusion, maybe a laminectomy, maybe a discectomy. We could clean it all up for you if you'd like.
I don't want to do that.
Well, then you, my friend, are in the wrong spot.